I welcome you all to another press briefing this morning, and without much ado, the Honourable Minister will brief the House.
Introductions.
Self-introduction. Self-introductions, please.
Why do you put it in the program?
The Honourable Minister, sir. Give his
One page. 1,000 million.
Ahead. Your phone.
Yes, it's everything.
You start? The Honourable Minister of State for Health, Permanent Secretary, Directors, Heads of agencies and their representatives, gentlemen and ladies of the press, I want to welcome you all to this briefing, the 7th in the series, and thank you all for the coverage. I also want to thank Nigerians for the confidence in us and for the continued support. The Ministry of Health continues to monitor all incoming travelers and select those that fit our case definition for secondary screening. Following declaration of a pandemic and increasing spread in some countries, we have begun a review of our own case definition. However, Nigeria has not placed a travel ban on any country passport or flights. Between 7 January and 12 March 2020, a total of 42 people who met our case definition have been screened for COVID-19 in 6 states: Edo, Lagos, Ogun, Yobe, Rivers, Kano, and the FCT, of which 40 tested negative and 2 were confirmed positive. And these 2 are the index case and the contact of the index case in Lagos, and we have had no deaths from COVID-19. The index case is clinically stable and is much improved. Steady progress till early next week will guide the medical team in discharging him. The second confirmed case, a contact of the index case, is testing negative for the virus now, meaning he has cleared the virus and will be allowed to go home. A group of 4 children and their teacher flew into Lagos from the United States, but prior to their arrival, Nigeria CDC was informed by US CDC that this group had been in the same space with a confirmed case of COVID-19. We therefore sent these travelers into isolation on their arrival, and tests were done, which came back negative for all of them. They will still stay in self-isolation for 14 days. As of today, 13th of March 2020, Nigeria has recorded still just 2 confirmed cases of COVID-19 with no deaths. 1 case is now negative and will be discharged from care, while the other will follow in a few days. After 14 days of follow-up with no symptoms, all contacts of the index case, both in Ogun State and Lagos State, will be allowed to go home and rejoin society. The multi-sectoral EOC, Emergency Operations Center, continues to oversee national response activities. We have progressed in assessing treatment centers and have now ensured that every state and federation, particularly those with international airports, identify a location that can be used to manage cases. We are supporting these states to scale up capacity to meet existing needs. On the 12th of March, yesterday, the Ministry of Foreign Affairs organized a briefing with members of the diplomatic corps in Nigeria. We provided the ambassadors, our high commissioners and representatives updates on Nigeria's response strategy. We also call for solidarity and cooperation in responding to this pandemic, and especially urge them to request their governments to introduce or tighten health screening at their point of departure so as to reduce the risk of exporting the virus to other countries. The WHO, as said, has declared COVID-19 a pandemic, which calls for cooperation and collaboration to increase resources to quickly detect and control this outbreak. It is not a call for fear or panic, which must be clearly understood. COVID-19 cases in China have continued to decline, which is evidence that the pandemic can be controlled. The Federal Ministry of Health is monitoring the global situation closely and seeking advice from the World Health Organization. The ministry, through the Port Health Services, will continue to prioritize measures for containment of COVID-19, especially screening of passengers at the point of entry. Citizens are advised to discourage spread of misinformation and to ignore to ignore fake news. We urge you not to take them seriously because the intent is to cause fear and panic. We urge you to rely also on information from authorized channels of the Ministry of Health, Center for Disease Control, or the state ministries of health. Nigeria Center for Disease Control has launched a new website focused on COVID-19. It is updated every day and has information needed for all citizens, including daily situation report, a guidance for schools, guidelines for health workers, and more. It is covid19.ncdc.gov.ng. I repeat, covid19.ncdc.gov.ng. Again, I urge all Nigerians to take care of their health and protect themselves and each other by continuing to do the following. Regularly and thoroughly wash your hands with soap and water. Do this at least 30 seconds. Or also use alcohol-based hand sanitizer. Maintain 2 meters between yourself and anyone who is coughing or sneezing repeatedly. Be sure you and people around you follow good respiratory hygiene, meaning to cover your mouth and nose with a tissue or handkerchief if coughing or sneezing, and disposing of used tissue immediately. Alternatively, cough or sneeze into your sleeve when no tissue is available. We We also urge you not to join or mingle in crowded places, congregations, and to stay at home if you feel unwell with symptoms like fever, cough, sneezing, or difficulty in breathing. If you have any of these symptoms, stay at home. I remind you again of the NCDC number, which is available around the clock, 080097 00005. Those are again 080097 followed by 5 zeros. I shall now say a few words concerning the point of entry on prevention and control of cross-border transmission of yellow fever. Due to ongoing transmission of yellow fever in parts of Nigeria, it is pertinent to activate Nigeria's point of entry policy on prevention and control of cross-border transmission of yellow fever in line with World Health Organization recommendation for all international travelers who are 9 months old or older who are arriving in areas with evidence of persistent or periodic transmission of yellow fever. The Federal Ministry of Health requested Nigeria's Civil Aviation Authority to communicate this message to airlines for compliance. Due to the COVID-19 outbreak, the Federal Ministry of Health reviewed the policy to allow passengers without yellow card or proof of vaccination to board their flight to Nigeria with the understanding that they will be given yellow fever vaccination on arrival at our point of entry. The vaccination is free of charge, and the yellow card is at a nominal cost. This is in the interest of the health security of the public and also of the passengers themselves. The effective date of the revised policy implementation is 11th of March 2020, and the revised policy was communicated to Civil Aviation Authority for airlines to be so involved. WHO recently declared COVID-19 outbreak a pandemic, and the Ministry of Health through the portal services also prioritized measures for COVID-19 containment, especially the screening of passengers at point of entry. However, other surveillance and prevention activities, including the implementation of the policy on prevention and control of cross-border transmission of yellow fever, are still very important and will not be ignored. Nigerians are therefore required to obtain a yellow fever vaccination if they have not yet done so, and to show their yellow card or proof of vaccination before embarking on any international travel and also upon return from international travel. The position of the Ministry of Health is in line with global best practices and also in line with World Health Organization recommendations. Thank you. That is the end of the briefing.
Thank you very much, sir. With your permission, sir, there will be questions and answers now from the floor.
Good morning, Honorable Ministers. Good morning, Permanent Secretary. Good morning, everyone. My name is Moses Emoriken from the Nation newspaper. My question is, we know that sports is a uniting activity in the country, sports, and now the National Sports Festival is going to hold in Benin, I think, on the 20th of this month, and that's a source of concern. So I want to know, is the ministry in talk with the Ministry of Sports, the sports ministry, to either postpone it, and if I'm not postponing that activity, what are we doing to safeguard the lives of our people? Thank you.
Good morning, Minister. Good morning, everyone. My name is Emeka Amarako. I work with TV360. Sir, in as much as we commend the Ministry for your efforts to contain the spread of the disease. A major concern actually is the Enlightenment campaign. We had actually expected that in various fora of this nature, maybe someone from the National Orientation Agency could have been present to actually make Nigerians understand efforts towards getting Nigerians more enlightened in its campaign towards the virus. What's your assessment of the campaign so far towards enlightenment? And is there actually room for improvement? Thank you.
Good morning, sir. My name is Friday. I'm a reporter with Chinese TV. Since the federal government is not placing any travel ban on countries, including the endemic countries, what specific plans do we have regarding passengers who may be traveling in from those countries? Are we thinking of sending them to or quarantining them if they visit our country from those endemic countries? And closely related to that is the case of our land borders. We talked about cross-border transmission of yellow fever. What is our approach to ensuring that the COVID-19 is not transported to our country through our land borders, especially now when we have very close neighbors that have reported positive cases? We have them just not too far from us now. Do we have any screening strategy to ensure that the virus is not also transported into Nigeria through land borders? Thank you.
Sir, I just want to clarify the second case that my name is Ruth Olurumbi. I work with Bloomberg. I want to clarify the second case. Was it that he was never sick or recovered?
Okay, I think we'll answer those ones first. Beginning from the last one, at the very beginning when we announced this contact of the index case, we did say that he had no symptoms. I think everybody can recall that. And he still has had those symptoms, but positive in test, and after several days, we're finding is negative. So that he was never sick, yes, because he never showed symptoms, at least no significant symptoms that are detectable. As to the next one, which had to do with land borders, well, we have repeatedly said that this virus anywhere where it was imported somehow, and in most cases is by people who came by air, traveling from endemic countries. That's what's happened in nearly every case. The possibility of land border transmission or seaport transmission is there, and we are working with our port health services in all these areas, supported by other border guard authorities like immigration and customs, to screen persons coming in and report cases that look suspicious, and also demand yellow card from such travelers. So we are doing everything. But if you are fighting a battle, you need to know exactly where the danger lies most for you. And in this particular case, it is through air import. So our focus is on airports, but we're not ignoring all the other areas. Enlightenment. The enlightenment is the business of everybody, and that is why we hold this briefing at least twice a week, and also join the Wednesday briefing at after Federal Executive Council. So it is not the job of NOA alone. We all support, and I'm sure that the National Orientation Agency listens to all of what we are saying here. They might even be represented here for all I know, and they make use of what we disseminate here, and also enlighten the public. But we must know that the purpose of this briefing is for public enlightenment. It's for you to be able to spread the news around, to give citizens the correct news. With regard to the sports festival, every country takes measures that are consistent with its own situation. There are countries where the virus is spreading widely and they have been forced to cancel various activities, whether it is even sports, whether it is even business, whether it is even trade fair. There are countries where they have done that, yes, but it's because of the threat that they face, where they have had thousands of deaths, people, all their hospitals are filled up. We are not in that category, we thank God. As it is now, we have seen a couple of cases which we have been able to contain, and if you don't have very pressing reasons, you don't have to start banning everything. But we are watching the situation, as I said in my briefing, very closely. Among what we do is very strict screening, and part of what we shall be, what we have been advising is travel restrictions of Nigerians, which I will repeat, to endemic, I won't say endemic, but high burden countries. We have repeatedly issued travel advisory to Nigerians not to delay or postpone travel to any high burden countries, except it's very essential. And we have also requested countries who have a high burden to start doing departure screening so that they don't find themselves being among those exporting this virus. So if with the combination of departure screening at various countries, particularly with high burden, and then arrival screening, we should be able to eliminate a large number of travelers. So as far as sports are concerned, yes, we shall recommend to the organizers to screen everybody who is participating, to screen all the spectators, because at the moment we don't see very strong threats internally. The 2 cases we have had have recovered, and we haven't had any since. So we are not really at this moment recommending ban on everything, unless the situation changes. But nevertheless, the precaution of making sure that every spectator is screened, and those who are in any way looking suspicious are disallowed entry straight away, so that they don't pose any kind of risk to others, and the symptoms are clear. And if they do that, I think there is good reason to continue and not to halt. There's no good reason to halt the festival.
Good morning, sir. Just like you said earlier, that the reason for this briefing is to give the public the right information. Sir, the first time you told us about the passengers on board the airline that brought the first case, you told us that they were 158. In your another briefing, you said they were 148. So we are now worried about the figures being given. Then number 2, you also talked about 71 million naira that you requested from the federal government for this case. Then the other day, NCDC talked about 1.6 billion that is needed. So, sir, I don't know how we can harmonize all these figures. What exactly do we need? How much do we need to contain this pandemic? Then number 2, the issue of Lagos. The figures you are also giving us, the statistics, are always different from what we are getting from Lagos. Is there any harmonization of figures before all these briefings? These are the things I want to find out, sir.
Good morning,
The first one.
Rachel from News Agency of Nigeria. Now, just last week on Thursday, Egypt has just 3 cases, but today they have like 80. It's more or less we can't predict the virus. So I don't know if the Honorable Minister is considering our 5 treatment centers case for our 5 treatment centers will be enough for us. I said I don't know if the Honorable Minister is considering our 5 treatment centers an increase, if we're considering an increase of our treatment centers in Nigeria, because the virus is not what we can predict. Now, second, what effort is the government making to increase the number of testing centers since we have just 4? And now, most private hospitals, they say they don't have PPE for coronavirus, and I don't know if the federal government is making effort to equip the private hospitals in terms of outbreak. Now, the last one, NCDC trained some private hospitals in Lagos. I don't know if that will be replicated in other states. Thank you.
The first question, please go over your question again.
First one.
Okay, Nkechi Onyedikugeze is my name. I work for The Guardian. Honorable Minister, my first question was on the number of passengers on board the flight that brought the Invest case to Nigeria. How many are they? You told us 158 and later 148. We want to find out the accurate number of people. Then also the number of people that have been tracked. Then number 2, the issue of, the money. You talked about 71 million naira that was needed, which you later talked about the release and the rest. But NCDC the other day also talked about 1.6 billion that is needed. So we want to know how much exactly does Nigeria require for this issue. Then the last was the harmonization of figures. Why does your figures contradict with what we get from Lagos on number of people tracked and all this stuff? Thank you.
Okay, so let's go on that immediately. The figures are generally the same. Depends on how you aggregate them. Sometimes we are talking about the number of passengers on the flight. Sometimes others are talking of passengers and crew. So by the time you're adding crew or removing crew, you are getting figures that look like they are changing. And all of them are, of course, true. The crew don't stay here because they go back with their plane. So the question is whether you add them to the passengers or not is always a question. But what we have done is to send the message through the international health regulations and WHO to the airline and to that country to notify them that this is what happened with one of their passengers and for them to do the needful for their crew. So among those who came with the aircraft, there are some who continue to other countries, who didn't remain here, and and others who in fact have already gone back to where they came from. So those ones are also notified, as long as you can trace them, to those countries through international health regulations to say this person came here on a plane which had a passenger with coronavirus disease on board. And that's a similar thing that happened to the 4 cases we got in Lagos, the 4 children, the 4 school children and their teacher. They were on an aircraft with a passenger who had coronavirus on board, and the country they went to, the CDC there notified us. So that's why the CDC notify each other. And that is how we were here waiting for those kids and their teacher when they came back. And the same way those who left returned to different parts of the world with their original airline were also told, those countries were also notified of the passengers who were on board. Now, as for those who were traced here, we tracked all of them accurately. 2 of them seem to have given false addresses, and we were forced to publish their names in the newspaper, after which they now reported. And we can see that none of them has showed any signs of infection. Again, let me use this medium to advise all travelers, when we give you the self-reporting form on the aircraft, it is for your own good and for the good of the public. So giving false information, false addresses and false phone number is not helpful to you, and it's also not helpful to the public. And it's not something that's supposed to harm you or to expose you to anything. So in those 2 cases, their names came out in papers, whereupon they revealed themselves after going into hiding for whatever reason. So I think that answers your question. As for the figures, the 71 million went to Port Health. I've told you before that we have the first line of defense in our endeavor is Port Health Services, who are at our international airports. Those are the ones who stop you first and check you and take your temperature, and they supply hand sanitizers and carry out second line interviews for those who are coming from high burden countries and so on. So they requested that amount and they got it. CDC is a second line of defense. They provide the background information and strategy. That's NCDC, and they received about 1 million. I mean, less than 1 million, but in total 930 something million that they got from the federal government. From federal government. Now, if you add what Port Health Service got put together, it's just a little bit over 1 million. 1 billion. 1 billion. But we have offers of donors from other philanthropists and organizations who have offered to support us. But the way this pandemic goes, when you are saying what is the exact amount of money you need, nobody can tell because nobody knows how it's going or where you're going. So that's too much of a question. Nobody can answer that. We can only make demands as the situation develops. So we have money to work with at the moment, and we're using the opportunity also to upgrade isolation and treatment centers and to provide and stock up on the things which we think we shall need, personal protective equipment to improve our protocol of infection prevention and control, and strengthen surveillance and monitoring. So that money is being used properly for that. I think we've answered those two questions. Okay. Yes, the private sector is well informed here. As I said before, and let me say that again, this is a virus that is expected to be imported. Some people think it's an indigenous virus that you see everywhere, so everybody should have that's not right. We're expecting that if it comes in, it must be contained. This example of what we saw now is is the scenario that we're looking at. So it is possible that anybody who has symptoms and has had a contact will report to a private hospital. But we don't expect private hospital to treat such cases. They should refer them immediately to an isolation center. So it's not for us to be providing people. Yes. To be providing people with all hospitals with equipment. That's not the way it goes. Okay, you refer immediately. Such a case is beyond the treatment of a private hospital. You recall that the index case that came in here, first of all went to a hospital, and the doctor was very clever and immediately suspected and sent that index case away to infectious disease hospital. That's what we expect all practitioners to do, not to delay, to have a high index of suspicion and to immediately refer a suspicious case to the hospital that's designated to do the treatment, and not to keep them unnecessarily.
Good morning, my name is Femi. My name is Femi. With your last answer, you have answered the question I had. But let me also ask you, how are we monitoring the activities of these private hospitals? Because I asked this question because we read from some of the reports from outside Nigeria that some doctors have been arrested for treating patients who show symptoms of coronavirus COVID-19. So how are we monitoring activities of the private hospitals in Nigeria?
Honourable Minister, please, sorry. I'm closer here. Honourable Minister, my name is Anule Emmanuel. Okay. My name is Anule Emmanuel for Agents France Press. So I'm just concerned. There's a popular saying that prevention is better than cure. And Honourable Minister, you can agree with me that already even advanced countries are taking proactive measures by banning flights into their countries from high-risk countries. Now, if you look at the case of the highly. If not for the fact that he reported himself to a clinic, was first tested, and then later on, found. You said at the last time stage of this disease, it hardly showed symptoms. Now, if you allow people traveling from high-risk countries into Nigeria, instead of banning just like other advanced countries are doing, don't you think you stand a greater risk of this disease, other than taking the kind of actions that these advanced countries are taking, like America? Thank you, sir.
Good morning, all. My name is Wanda Abdella. I'm the Hashtags Identity. My question would begin with the issue of travel bans. Now, a travel advisory has been issued. To me, it's like user discretion. And the countries mentioned, China, Italy, South Korea, I think Iran, and Japan. If at this stage, maybe because we're lucky, we're still talking about a very, very low single digit case +2. And it means people come in, people go, and user discretion. 2 weeks ago, when we held a meeting, the interministerial and non-sectoral stakeholders meeting outside Abuja, issues were raised, and one of them was the fact that there's no isolation space or center at the airports, and the Director of Health that there's no such for now. I want to know what has been done between then and now. If we're not placing travel ban, what have we done? Secondly, I took a look at the map of the COVID-19 labs in the country, and I discovered the low-sidedness. 2 in Lagos, 1 in Osun, 1 in Edo, then 1 in the FCT. That makes 5 labs. Yes. So that makes 5 labs. And I looked further, and I looked at the northeast coming down to the southeast. Why do we have such low-sidedness? Don't we have maybe restitution hospitals that could be upgraded to be able to do that without necessarily taking samples from, let's say, Yobe down to maybe Edo, FCT, or Osun or Lagos? Then the second case, that's the one that was through contact, and has not presented symptoms. I need clarification on that. What's the implication of someone testing positive to COVID-19, which indicates that you have the virus, but you don't present symptoms? Then you're taking it to maybe going to isolation or quarantine. Is it the same process? Is it a situation where you wait for the virus to clear totally from your system, or as you keep treating? I just want explanation on the difference between the two. Then finally, and I always harp on the issue of research and development. I was glad to see the DG Nightcrane here and the presentation he made, the health sanitary we're able to come up with. Beyond that, how much are we deploying into research and development at this point in time? The emergency components of the basic healthcare fund is there. Has the implementation commenced? Is it part of the COVID-19 funds that is being utilized? Thank you.
I work with this. My question is, I want to ask whether you've been able to compare or assess the impact of this advisory, travel advisory to Nigerians, not to embark on trip to these high-volume countries. Has it had any impact? Have you been able to track that? And then, secondly, some countries like Iran and Korea, they've had high incidence of infection. Has Nigeria been able to understudy what they have given rise to that? Because it might not because of distance or closeness, whatever. What have they done so that we can leverage on that to keep Nigeria in safe hands?
Okay, I think we better answer to the questions that have been posed. The question of banning flights. I've said that every country will take the measures that suits its situation. There are countries that have done blanket ban, and well, that is their own decision. Because you weigh everything, the risk to you, the capacity you have to cope, and the impact of the ban on you, on life, on your economy, and so on. So if you weigh everything, you take that decision, you advise government, and government will give you a decision. So we here, so far, we are noticing some things, and that is that, first of all, there's already a lot of self-restriction going on. If you listen to stories of those who are traveling through Heathrow, they will tell you that it's almost empty, that there's a reduction in passenger movement. Airlines are very heavily reduced. They are cutting flights. I heard that a major airline has said it's cutting 3,000 flights. So there's already, without banning anybody, there's already a restriction in movement in place, without you expressly banning this or that. They already, and many airlines are discovering that, again, if you are taking a flight that takes you 10x amount of dollars to operate, and you have passengers on board that give you only 1x return, then that flight is not worth it. So they cancel flights. So a lot of flights are being cancelled. People are already restricting themselves. So that self-restriction is in place without you doing anything. In our own case, we have looked at the impact. You know that the government is already looking at the economic impact of all of this on our economy, as other countries are doing. In some countries, they tell you the shares are falling, the value is dropping, and so a number of people have been relieved of their jobs. People have been sacked because there's no business going on. Tourism is down. So they're looking at all the impact on themselves, and we do that too. The federal government has set up a committee to look at the economic impact. So therefore, what we do, we weigh everything. What are the benefits? What are the costs? What are the losses? And as far as we can see right now, the risks we have here are relatively low, and we are monitoring very closely. I have conversations with NCDC several times a day, with the commissioner in Lagos and Ogun. We talk several times a day. I'm talking to various other experts, and also talking with the higher authorities to be able to make sure that we're up to speed with what is going on. Even regarding activities here, I told you just now about the sporting activities. We are in touch with those who are organizing it and assessing the risks and also what measures can be taken. So banning flights, even without banning flights, you're already having serious impact on the economy and the crash of oil prices and so on. So the situation decides what measures you take, and as at now, the measures we are taking are appropriate to the situation. We don't want the measures to be too much and not too little. As far as isolation centers, we only build we have many isolation centers in Nigeria, very many. Some are ready for TB, some for Lassa, for different kinds of diseases, and you can't put them together. So it's not that you have dedicated isolation centers waiting for you for COVID-19. So right now we have to develop new isolation centers or clear certain wings that can be used for isolation centers. And we have backup plans. We have a backup plan in case this one is full. What do we do? The last multi-sectoral and interministerial meeting we held, we had CMDs of various teaching hospitals, and they were told, if we have a large number of cases, go and look for, can you tell us a place that we can have open within 24 hours? They have looked into it, they have given us answer that we can have these 200 beds ready for you, or 120 beds ready for you, if the need arises. It's a backup plan. It's like a plan B, and even there's a plan C we have about setting up tents in case there is a need for it. So you don't want to take measures that are excessive and cost you a lot of money and yield no value. So you want measures that are tailor-made for the situation you are in.
The chairman of the CMD is it?
Yes, in fact, in that connection, I will allow the CMD of the chairman of all the chief medical directors of our teaching hospitals to say a word in respect of that. The preparation we have told the CMD, and the CMDs I'm talking about are the ones in the cities where we have our international airport. In fact, yesterday I saw the CMD of the University of Port Harcourt Teaching Hospital, and I asked him, he's ready. So NCDC will go to those places, examine them, work out the strategy. We're not going to mobilize it until we need it. So we don't start mobilizing and then have places that are locked and not in use. CMD, please say something.
Thank you, Honorable Minister.
We want to see you. We want to see you.
In respect of our preparedness, particularly at the entry points, the 5 states that are major entry points by air, all the teaching hospitals in those states currently have isolation units they've been using to manage Lassa fever in the past, and they are being upgraded or have been completely upgraded already. We recently also received a letter to work with the DG NCDC in a committee that we ensure that we get all the necessary equipment that will be used in case we have a case coming to our end. For instance, in Abuja, something has been done at University of Abuja Teaching Hospital and the National Hospital. We have upgraded our Lassa fever isolation unit that we'll be using from 2 beds to 5 beds now, and we are trying to get additional equipment in terms of intensive care equipment, because if a critically ill patient is there that may need ventilation, you don't want to move to the central ICU, you want to be able to ventilate the patient there. So all this is being considered and being done, and as we have just heard from the Honorable Minister, additional money has been given to NCDC, and we have been told to, or they have been told to work with us in a group to make sure and visit those centers we are upgrading to make sure they meet the standard. Thank you, sir.
And as for the laboratories, most countries, there are many countries that have just one laboratory, and for this particular virus identification, we have these laboratories. First, you must have the machine, the PCR machine. Then you must have the specific primer that can identify the virus. Now, these primers, they are very hard to come by now because so many countries are demanding them. Luckily, we have a good stock, and I've already told NCDC to make sure they procure more. Just the other day, one very famous public health expert was accusing their own government that they are under testing. So you can expect that some powerful country will start to mop up these primers, but we still have a good stock. And now, once you take a specimen, all you need to do is send it straight away, either by air, by road, to a laboratory that will test it. It's not every laboratory that has to go to test. Right now, we've done only about 41 tests using 2 laboratories or 3. But we have 5 laboratories that are
is power. Everyone wants power. So feel powerful with the NTA News mobile app, the one-stop information.
This is a sequencing of the COVID-19 strain in Nigeria. That's part of the research process, which already helps us, puts us on the map, and the Director General of World Health Organization congratulated Nigeria for that achievement, and it is the basis on which scientific and other vaccine-producing organizations are now trying to work on a vaccine for it, because once you have the genetic sequencing, you can start thinking about creating a vaccine that will neutralize the virus. Yes, we are participating in the research. We are not sleeping and keeping up with what the developments are. This is a very new virus, and so a lot is being learned about its behavior.
Fake news from the bunch. The issue of fake news. Somebody mentioned that fake news.
The French, Agent France. I think that's all I can find here. Fake news.
Somebody was asking about the doctors.
Okay, yes. Well, we are holding this briefing so that you hear directly from the source. Anything you hear from anywhere else is not something that you need to go with. So if you are hearing about fake news about doctors treating, I don't think any doctor in his senses will actually take a corona case virus and put it in his hospital and treat. And then without endangering himself, his family, and his wife. So, I mean, if you look at it, it does not make sense. I don't think anybody will do that. If you are a doctor and the coronavirus comes to you right now, will you put it among your other patients and treat it? No, you will not. So that story does not make sense at all. But people have sent hold on, let me finish before you start. So people have brought rumors like that, but we also have situations where people have reported to a private hospital and the doctor has suspected that this might be corona and send them immediately for treatment. I mean, for diagnosis, and it turned out to be negative. Most of the 41 I said we have diagnosed, of those ones, many came from private hospitals. So immediately private hospitals get rid of these patients straight away to IDH. So I don't believe that there's one. First of all, it has to be diagnosed, and you can't diagnose it unless you use a PCR machine. So if you are treating somebody who has cough, catarrh, well, and you can't be sure it's COVID-19 unless it has been put through a machine test. And 5 laboratories can do it, no other lab. And if those ones haven't done it, if they do it is positive, they are going to ask for the patient. You understand? They are going to ask for the patient if it happens to be positive. Yes.
Okay, Honorable Minister, sir. So there is no doubt that you are giving a very documented update on this issue with facts and figures. Then for reason of accurate information and to do our job, why is it always difficult for the ministry to make this thing available to us? Either through email,
about the report itself? The copy. Well, all you have to do is tell media to produce it. That is very easy.
They will do it now.
See? Okay. And I also see a barrage of microphones here who are recording. You can get from them too. Okay, any more questions please before we close?
My question has to do with the match Nigeria is preparing for.
I think it was answered. It was question.
My question has to do with the match Nigeria is preparing for. We are about to meet Sierra Leone in an international game, and we have invited players from all over the world, including countries where this virus is well reported. How are we going to? These players will not stay in Nigeria for days. We'll be here for probably a week or 1 week.
They say one big disease don't enter town, okay? What's the name of the disease? Coronavirus, okay? They say the disease, if they fly for air like this, like windshield.
Oga, stop palm now. Corona not dey fly like winch, and running away not go solve the problem.
What is the solution?
Good question. Federal Ministry of Health don't join hands with Federal Ministry of Information and Culture. Say, if we follow some very simple instructions, we go prevent the spread of this coronavirus. Anytime when you sneeze or cough, cover your nose.
Where all the players are coming from. But I know that if it's against Sierra Leone is also not a country with a high burden. So two countries with very little or nothing in the coronavirus, that already poses little risk. But if you say that players are coming from other countries, maybe coming from Iran or Italy, that I do not know. But it might be left to the wisdom of the managers to excuse themselves from those ones we don't know. But if we are asked for advice, we shall give advice.
Okay, Minister, just to follow up, please. My name is Doshima Abu. I report for the BBC News. And while we're talking here, audiences just wanted to know if, when you're answering the issue of the travel ban, they wanted to know if the country is prioritizing economy over the people, because they fear that if these doors are open, that there's a likelihood of we having more casualties or more cases, or there could be more of this coronavirus, those infected coming in. So is the country prioritizing the economy over the safety of its people?
The answer to that is no. We're not prioritizing the economy over people, but we want to make it very clear that in responding to the threat of coronavirus, you do so with as little collateral damage to yourself as possible. So you respond responsibly, and also do not necessarily go after some fly with a sledgehammer. So we want to be able to get a purpose-built response that takes care of the citizens, but does not necessarily cause serious damage. The other day, we advised envoys to start more departure screening in their countries, because there are people who have arrived here from abroad who were very sick. They had catarrh, cough, sneezing, and they were immediately identified by Port Health Services and taken straight for screening, and they all turned out negative. Maybe they just had an ordinary cough and catarrh. But if they were screened in their countries, they wouldn't have been allowed to board, and they would have saved us the stress of and the patients the inconvenience of being taken straight away to isolation. So we advise them, do the screening. Anybody who is not well, who is looking unwell, tell them to stay until they get better and delay their travel. So in the same way, we do not like to put restrictions where we do not think that they are helpful. Where the restriction is helpful, we place them immediately, because safety of citizens is prior. But our situation is different from the situation of China, is different from the situation of Iran or Italy, and therefore we are not going to be using the exact same methods that they use. And we are monitoring the situation so closely that if there is any change, we are going to respond appropriately. We are measuring everything very carefully. We have experts in epidemiology and public health and virology who are advising us and talking to us about the best approach for our situation. Every solution is country tailored. Thank you. I think that's all. Thank you for the briefing.
See you again on Monday.
They will take Look, you are picking this without paying me. 1,000 pounds.